Hello and welcome back to GP Video Podcast by Nadia. Today our topic is called Diabesity. Have you ever heard this before? If you remember, I have discussed with you guys metabolic syndrome, which had four components: diabetes mellitus or high sugar levels, high cholesterol levels, high BP and obesity. These four things together, or two together, or three together, and they contributing to heart attacks and strokes and other diseases. So if you remember that, then you should know that diabesity is called a combination of diabetes and obesity. So that's our topic today. So diabesity is a term coined by former US Surgeon General C. Everett Koop, and what it does is it raises awareness of the health effects of obesity. Okay, so it is a constellation of signs that includes abdominal obesity, high blood pressure, systemic inflammation, high cholesterol, high blood sugars, and a tendency to form blood clots. As you guys know that I am very much passionate about losing weight and obesity and treatment of it, because obesity is the biggest risk factor for developing type 2 diabetes mellitus, and eventually it is the biggest risk factor for developing heart disease or coronary artery disease or heart attacks and also strokes. So if we control obesity, if we weight manage well, then we can bring our blood pressure down, we can bring the cholesterol levels down, we can improve the insulin resistance, and we can bring the sugar levels down, and hence we can improve all the coronary cardiovascular risks and the risks associated with strokes and cardiovascular disease. So management of obesity plays a very important role. As you guys know that these days there are so many young deaths happening because of the heart attacks. It's very, very, very important to be highlighting the importance of obesity and its management every now and then. In a health study, it was found that the biggest risk factor for developing type 2 diabetes mellitus is the body mass index or obesity or weight. The prevalence of diabetes mellitus was 2.5 times higher in overweight men and 3 times higher in overweight women when compared to normal weight group. Unfortunately, not only obesity increases the prevalence of diabetes, it also makes it more difficult to treat. But why? Why obesity hinders diabetes control and increase mortality or the death rates? Because obesity increases insulin resistance and glucose intolerance. It exacerbates other metabolic complications such as hypertension and dyslipidemia or high cholesterol. Regarding mortality, which is the death rate, compared with normal weight individuals with diabetes, the mortality rate is 2.5 to 3.3 times higher in diabetics with body weights that are 20 to 30% above their ideal weight, and 5.2 to 7.9 times higher in those with body weights 40% above ideal weight. So the more obese you are, the more chances of you, if you have diabetes, the more chances of you having more complications and having increased death rates. So weight management at Diabesity Clinic. Weight loss is the first priority in a patient with newly diagnosed type 2 diabetes mellitus. Calorie restriction and weight loss have a positive effect on almost every risk factor associated with diabetes and obesity. This time I'm actually interested in talking about all the weight loss options one by one, though I have already spoken about them in previous podcasts as well, but I would like to take them in more detail because people who have missed my previous podcasts and have not been listening to them regularly, then it's a good chance for me to again catch up with whatever I have said before and add more. So as you guys know that people who are diabetics are also on anti-diabetic usually are on anti-diabetic medications for the control. Not all anti-diabetic medications will cause weight loss. Now, some of them will cause you to stop from gaining weight. Some of them will induce weight loss, and some of them will actually induce weight gain. So when we are choosing the anti-diabetic medications, we have to be very careful and see which ones are the ones that will cause weight loss specifically, if diabetes is also associated with obesity, which is usually the case. And then I'll also talk to you about what are the oral options available for us, not only anti-diabetic medications, but the other appetite suppressants as well, and what are the injectables. So we'll go through this all together, though I'll be continuing with my other topics as well, like depression, like bipolar, and like the others that I have left incomplete. So we'll talk all about all of them, because I'm usually making a couple of podcasts a day. So I'm sure I'll be able to cover all of them. So diabesity is the new term that I think I've introduced to you guys today. Diabetes and obesity together, and they together are a killer combo. So we really need to control them. Alrighty, see you guys then.